Thank you very much. And basically what I'm going to talk about today, let me get my screensaver off there, is clinical documentation and voice recognition. And as I was introduced, basically my background is I've been an emergency physician for about 30 years. I've been in the UK for about 6. I was a full-time clinician up at the Royal Lancaster Infirmary for a couple of years, and then as Morecambe Bay decided to become early adopters in the national program, I sort of went over to the dark side and joined the informatics department. And yet I still do a weekend a month in the emergency department out in Furness General Hospital out in Barrow and Furness. So I got tired of writing, and with the advent of the electronic patient record for Morecambe Bay, Lorenzo, who had been casting about trying to develop the best method for clinical documentation. And there's several different methods that we'll talk about, but my personal favorite is voice recognition, because I think it works pretty well. And I'll show you what I do, and I'll show you how it works, and you can judge for yourself whether you think it's ready for prime time or not. So what about entry? Well, how are you going to enter clinical impressions into an EPR? I mean, numbers are easy. It's simply a database exercise, but adding the clinical impressions of any clinician, whether it be AHP, nurse, or doctor, is difficult. There are only a few different ways to do it, and certainly handwriting obviously is the start, but handwriting has its obvious disadvantages of legibility, and certainly clear text I think is the gold standard, and I think that's what most clinicians are used to reading. So then digital pens have been around, and I've tried a couple of the digital pens, and I think they work okay if you're just trying to capture tick boxes on a form. If you're trying to capture handwriting and any sort of narrative, I don't think they work very well. And the reason is because what they give you is they give you an image of the form, okay? And so you still get the doctor's terrible handwriting, and it's not searchable, it's not codable, and it's barely legible. And it's really, I don't think, much of an improvement over using just a regular ballpoint pen. Now, all the vendors have said, well, we get handwriting recognition with the digital pens and all that. Well, as I said, in the 2 that I've tried, the handwriting recognition was inadequate, and it was way too much time in correcting. So from my perspective, I gave a thumbs down to the digital pens. Tablet computers are another option. We've seen lots of tablets out there. The handwriting recognition in tablet computers using Windows XP is fair, in my opinion. It doesn't learn. It continues to make the same mistake every time. It never recognizes my eye. I want to do this. Anyway, it doesn't learn. And in my opinion, it's very difficult to use for more than a few words. Windows 7, however, the handwriting recognition, I think, has taken a quantum leap forward. It does learn, and I think it's much better. So I think using the tablet computers, the handwriting recognition, if you're running Windows 7, I think is probably a viable alternative. But again, it's tough to write more than a couple of sentences with it. It's not fast, and it takes much longer to do it. But it's an alternative, and it does work. So that's, at least I think in Windows 7, it's moving along. I think the key in any sort of data entry form that you're using in an electronic patient record is the design. And if you design a form properly so that you're capturing a minimum amount of free text, that's your goal, because you want to be able to have it be usable on a touch screen like a tablet, as well as on a workstation with a keyboard. So, if you design it for a touch screen, you can use it in both places, but not necessarily the other way. So how are you going to deal with free text? I mean, there are only a couple of different ways to deal with the free text issue and how you capture that clinician's impressions. So obviously the keyboard is sort of the way we've always done it, but they're not, certainly the younger generation is used to doing everything with their thumbs on a QWERTY keyboard on an iPhone or whatever, or twittering away with whatever message they want to do. But us older clinicians, very few of us, I think, have really learned to touch type, and many are still doing two-finger typing. And that gets really difficult for the clinicians, I think. So then there's the next issue is digital dictation and transcription. Well, I mean, that works pretty well. Most clinicians are very used to dictating, and that works. The problem with digital dictation, I think, is there is an attendant cost to it, in the sense that the transcription for whatever method you use, whether you outsource it to a foreign country or you do it in-house with your medical transcriptionists or medical secretaries, there's an attendant cost to it, and there's a turnaround time. Okay, so at least for emergency medicine, I think contemporaneously having a text entry is the way to go. You need to be able, if that patient comes back in 12 or 18 hours or after you've gone off shift, nobody can figure out what you've done to that patient unless you have that note available to you. And that's why I think voice recognition, at least for emergency medicine, is the way to go. Now, you can certainly use digital dictation in other forms and in other clinics and other clinical situations. You can certainly use a keyboard or the other things. But as we get to the end here, I'll show you, what I do, and you'll see if you think that my way is a good way or not. So let's talk a little bit about voice recognition. So it started in 1952, was also exhibited in the 1964 World's Fair. And the first time I ever came across voice recognition was with the Kurzweil system in the early 80s. And it was a very difficult system to use, and you had to talk like this. Well, you can just imagine how difficult that is. And but as you'll see now, Dragon, which I think is the better of the systems, the software that's out there, allows you to talk in continuous stream of thought and continuous sentences in a regular voice pattern. And I'll show you what I mean by that. So Naturally Speaking came around in about 1997. It's gone up to version 10 now. It's got the specialized legal as well as medical vocabularies, and as I said, it gives you that natural flow. There are other engines out there. Philips Speech Magic is out there. IBM Via Voice was one that also is out there as well. And but my experience has mostly been with Dragon, and I found it to be a very effective voice recognition system, not only professionally but also at home doing letters or other emails. Certainly voice recognition is used in other areas such as military aircraft and air traffic control, and say 1 for English or press 2 for technical support or whatever. You've all heard the voice trees when you call T-Mobile or whoever to get support for your phone. But anyway, Dragon, as I said, the current version is 10, and what I have is a medical vocabulary, but it's a combined medical and surgical vocabulary. So there are specialized vocabularies. There's radiology, there's pathology, medicine, and surgery, at least through the particular vendor that we're using, which is GHG or Talking Point. And what they did was they combined a medical and a surgical vocabulary to give me essentially an emergency or an A&E vocabulary, and it works pretty well. So Talking Point overlays it, and you can see it sort of there at the top of the screen. There's the Dragon bar, and that's the Talking Point thing, you'll see how that works in just a second. But basically, the advantage of the Talking Point software on top of Dragon is that it helps you manage the voice profiles. So every user has a voice profile, and it gets stored on the network. So if you move around your trust and use different workstations, you can load the Talking Point and Dragon on 100 different PCs, and wherever you go, then you can just download your voice profile through the network in about a minute or so and be ready to go wherever you are. You can use either a Philips Speech Mic, which is sort of a handheld microphone, or you can use one of these headsets, which is my preference because it has a noise-canceling microphone on it. And that's what I use in the middle of a busy emergency department with everybody yelling and screaming and bins dropping and everything else, and it doesn't phase it a bit. Whereas the speech mic, which is a little more user-friendly, doesn't have the noise-canceling feature, and it's great if you're a radiologist and you can shut the door and you got a bunch of TV screens all around you, and it's a quiet environment. The speech mic works very well. So, at any rate, the radiologists have been using voice recognition for a long time, and but they're their vocabularies generally are not as extensive as medicine and surgery are, and pathology uses it also in our trust. So we've got about 70 users now. We've got about 70 licenses in our trust for the different clinicians. And the nurses use it as well. We have a whole program with the breast nurses. They use it for their clinical documentation of their notes and follow-up for their patients as well. So what are the limitations of this? Well, the voice profiles are individual to each user. And, as an example, I tried to initially to train on a UK voice profile because I wanted the UK spellings and all that sort of stuff. Well, obviously with my accent, that didn't work. And so I had to go to a US profile, and it worked fine. But now I've got not enough U's and too many Z's in my notes. So but it reads the same, and everybody gets used to it. So a little bit of Americanism for the NHS. But there's an initial and supplemental training. So the initial training is about 10 minutes, and you read a pre-programmed text. And then you're, sort of right out of the box, you're at about 80% accuracy. And then if you read a bit more to it, there's a bit of Alice in Wonderland or 2001: A Space Odyssey. You can read for about 20 or 30 more minutes to it, and that boosts your recognition rate up to about almost 90%. And then working with it for about 2 weeks, the training that you do with it, it learns your mistakes. And so you train it as you go, and it continues to improve till you get to about 98%, 99% recognition accuracy, which is what I generally get pretty close to that. You also get, with the Talking Point license, you get 2 half-day training sessions. And the thing about the voice profiles, they are pretty large. They're about, when they're a mature voice profile, they're about 30 to 50 megabytes. So really it's best to reside it on the network, on a server. But, I keep it right on my laptop as well. And I use this laptop, I set it up in the middle of the A&E, and that's what I use. And I've been doing it for about a year now. And I do probably about 99% of my notes. I do in real time, and I'll show you what I do. So the only other limitation is you really need 1 user per workstation, because the time required to change users, you can certainly do it, but it's about 2 or 3 minutes to change users, because you have to upload your voice profile and save it and then download the next one. So it's better if you have 2 clinicians working together, 2 workstations. Okay, so that's only a hardware limitation, but just to be aware that's there. Scalability has always been one of our questions about it. Is this really going to work for 300 clinicians in our trust? And that's one of the things that we're working through at the moment. But make no mistake about it, this is complex software, and there's definitely a steep learning curve to it. And it takes really about 2 to 3 weeks to get familiar with the software. And if you're not familiar with dictation, it'll take you even longer, because you have to tell it everything you want it to do. All the commas, all the periods or full stops, every new paragraph, every new line that you want, every hyphen that you want. You have to say it. If you don't say it, it doesn't do it. So if you're used to having your secretary, used to your style and add all your punctuation, it'll be difficult for you, because you have to change your style. It's a piece of software like anything else. It's a computer. You have to direct it what you want it to do. But if you are consistent in your method of dictation, it works pretty well. How do I use it? Well, there are a variety of input microphones. There's pen microphones that need USB ports. There are Bluetooth headsets that are promising. A wired headset with a noise-canceling microphone I find to be the best, and this is what I use, and it works pretty well. I basically Startup Commander, which is this thing on the top. I've already done it just to save time. But the other thing is you can also use it on a Motion MCA. This is one of the this is a different color, and this is the F5. And the advantage to this one is that in here, we're in the charging port, they have a built-in USB port. Okay, whereas the other ones you have to clip on something or have it in the cradle. So with this, I'm not using this just because it's easier to do everything through the laptop. But I have used this. It's got the identical software on it. The same thing, I can run Lorenzo on it, and it works fine. And you can certainly do this, walk around with it if you wish. If that's your style.